Good morning. I think everybody, you good. You can read the slides. This session, the impact of technology and digital media, TDM usage on youth mental health and well-being. I'm Jim Griffin. I am the chief of the Child Development and Behavior Branch at the Eunice Kendi Shriver National Institute of Child Health and Human Development, deep breath, National Institutes of Health, another deep breath, U.S. Department of Health and Human Services. And two quick announcements. One, Dr. Harold Koplowitz will not be able to attend. He's not going to be at the conference or be on the panel, which is regrettable. Also, I just want to let people know I'm only going to be able to attend the Congress today. I will be here through the end of the day. I don't know how many people know the significance of September 30th. It's the end of the fiscal year, and come October 1st, I may not be gainfully employed anymore if Congress shuts us down, but hopefully they won't do that. And I have some good things to say about Congress in a minute, so hold on. Okay, let's see if this works. Oh, okay, that's me. There we go. First, a disclaimer. I think everyone on this panel, including myself, works for a nonprofit, so we don't have any answers. I like that. Anyway, so here's the happy thing about Congress. You maybe heard some not so good things, but I will say some good things now. And this is an education about CAMRA, not the camera in your iPhone or your Nikon or whatever. It's the CAMRA ACT. This is from a White House press release. On December 29th, 2022, President Biden signed into law, it's the Appropriation Act, but it included, which they've been trying to pass forever, the Children in Media Research Advancement, or CAMRA ACT. And this is really important because it directs NIH to launch a research program on technology and digital media's effects on infants, children, and adolescents in core areas of cognitive, physical, and mental development. Critically, Congress appropriated $15 million for the first year of this initiative. First of all, I want to recognize the people who really pushed this through, which is Senator Markey of Massachusetts and Representative Raskin of Maryland. And they got this into an appropriation bill because they just couldn't get it passed separately. And in terms of the $15 million, don't get too excited, already spent on existing and new projects, but we had to spend it this fiscal year. We don't know what the next year will hold. But very briefly, just highlighting, there are only two sections here, the CAMRA Act. One is study of the effects of smartphone and social media use on adolescents, and this, the National Institute on Mental Health, is taking the lead on. And my colleague there, Dr. Julia Zaire, is not able to be here today. She's at another meeting, but she's leading that. But again, this is really important because that B point, disparities in mental health outcomes of rural, minority, and other underserved populations. And as we heard from the previous speaker, this is critical. These are often subpopulations who have not been included, or frankly, a lot of the research conducted to date has convenient samples. They're white, they're middle class. They represent the white middle class, but they don't represent all users. And I think you're going to hear more of that in the panel today. Foreshadowing. The second section, okay. Brief musical interlude. Section 1432 is research on the health development effects of media-related technology on infants, children, and adolescents. Now, what I really want to emphasize here is the developmental focus. Infancy through adolescence. Some people, they want to focus on social media. What are the infants? Infants don't do social media. Anyone who's spent any time with an infant toddler, okay, this starts early, and we need to start early. And I think a developmental lens is the correct one, because as you even heard with the previous speaker, we know a lot more about executive function skills in the development. And that's what's, the fore part of our brain that helps us in decision-making and also impulse control, things of that nature. And we know a lot of that doesn't mature. There's a second maturation period that doesn't happen until late adolescence, early adulthood. Okay. I won't go through and read all of this, but the point is, too, Congress got it right. Oops. Now not working. Okay, now let's go back. There we go. Look at the laundry list of things they included here in terms of exposure to. This is really good, in my opinion, and one of the reasons I use the title, and I'm really trying to popularize using the term technology and digital media, because it's much more inclusive than just social media, and it gives an index term that everyone who does research in this area can use, and whatever other term they use, because the science isn't accumulating. It's very siloed by discipline, by journal. You know, people who study social media don't know anything about gaming, and they don't know anything about, you know, da-da-da-da-da-da-da. And that's really problematic from a scientific standpoint. Silos are just no good. So I think they did a nice job here. Okay. There we go. The next thing I think Congress did right, they called for us to create a research agenda. Yes, we're funding more research, but the idea is where is the there? And this is a crowded house. There's a lot of people doing a lot of research in this area, a lot of people convening meetings, including this Congress, which has been convened for years, and I applaud Pam for all of her efforts over the years at raising awareness and increasing awareness and trying to bring researchers together. But the problem is right now, there really isn't a very good overarching understanding, conceptual model, research agenda or plan that while it's gonna be all sorts of, you know, stem and plot leaf type branching, but at the same time, there has to be a sense of what are the commonalities? And even the fact that can adolescent researchers learn something from people who are studying infants and toddlers, and vice versa? I think absolutely yes. And can studying typical development and TDM exposure and usage inform atypical development and even psychopathology? I think the answer is clear from a scientific perspective. The answer to that is yes. And again, the fact that they covered infancy through adolescence in spelled out developmental domains so that we can't just ignore any of these: cognitive development, physical health, mental health. And again, reminding everyone, this all takes place in one child, one infant, one adolescent. And it's so easy. Again, I only study 13 to 15-year-olds. I don't really care. Anything before, anything after, that's what I study. Okay? It's not how science operates. Okay, enough of that. The questions posed to the panelists, I take responsibility. I came up with these, and again, I did that little intro because there was time, because we don't have one of the speakers, but I want to quickly now turn to the panelists with the idea being we really wanted to have a lot of discussion among the panel, with the audience, questions, things of that nature. So I really asked them to keep things very focused and you know, not everyone do 20 slides like I just did. Anyway, I am not going to be introducing the speakers. I'm asking them to introduce themselves. There's more biographical information in the program, again, to save time. But I can't tell you how happy I am this panel came together the way it did and all the different areas it represents. But again, this is meant to be interactive, not just, you know, unidirectional. With that, Cindy, if you'd introduce yourself, we can go from here.
Thank you so much, Dr. Griffin, and thank you all for being here. This is actually my first conference here, and I'm just absolutely delighted and absorbing everything as we speak. I'm a clinical and developmental psychologist from Brigham and Women's Hospital in Boston, and my work focuses on stress and mental health. It's quite broad, but I have a particular focus on studying underrepresented groups, and in particular a line of research on Asian American children and families. My work comes from my own lived experience, but as well, it really has become much more defined given a lot of the anti-Asian sentiment that we've seen over the past several years. So I am primarily a researcher. I don't practice anymore, but my work really, I came upon sort of trying to understand the role of social media because of my interest in socialization. As a developmental psychologist, you know, in my training about 15 plus years ago, focused a great deal on parents. in early childhood and the role that parents have in cultivating their children's development. And we always know that there's so much more work on parents than there are of peers. And quite honestly, social media has really sort of blown that apart, due in part to the accessibility of social media and just what I would consider an outsized role played, considering the fact that we focus so much on these other, what we would call socialization domains. And we came upon this in a variety of different ways through our research. One is that some of the work that I'd studied in terms of discrimination, we were starting to really find that with discrimination, there's all sorts of different discrimination. We often think about it in terms of structural discrimination or interpersonal discrimination, but discrimination that happens in this other context which is invisible to us. That is something that we have not measured or assessed in terms of its effects, and we've seen that it actually has a huge influence on Asian American teenagers in particular. Some of the recent work that we've embarked on includes a 5-year study funded by NIH, as well as a 2-year study, a 2-year grant that we also got for this work called the Boba Project. So you got it right, Boba is bubble tea, and it's something that I think a lot of people, not just Asians, know about. But it also stands for building our bonds authentically. And I'm doing this work with Linda Schmarman here in the audience, who's our social media expert. I'm not an expert in social media by any means, but what we are understanding with this project so far, even in its early stages, is that we are trying to study parent socialization in terms of how teens understand their identity and their racial identity. And the teens are saying, our parents are not saying anything about that. In fact, just a couple of weeks ago, as we were conducting a sort of informal focus group with our youth advisory board, our youth was saying that how they understood or how they've started to identify themselves as Chinese Americans was really not from their parents at all. Their parents might have talked about their culture, but they didn't even know the label of Chinese Americans or Asian Americans until somebody at school said that. And they thought, hey, that might be me. Or through social media, where they see somebody describing their experience and they really resonate with that experience and they go, hey, I think I might be Chinese American, or maybe I'm American born Chinese, or maybe I'm a second generation Chinese. There's so many different labels. And for me, it really led me back to my own upbringing and thinking, gosh, how did I understand my identity? And recalling the very same thing, that it was a collection of these different experiences, different exposures to various people that led me to figuring out who I was. And so you think about other racial groups and whether or not they go through that same process. But for Asian Americans, there's a lot of uncertainty, especially with stereotypes. So through anti-Asian hate, being thought of as dirty, somebody to blame for the virus. But on the other hand, being a model minority, being high achieving, being really good at what you do in school. And so this really sort of contrast in identities have really led to a fair amount of confusion in terms of that developing identity within adolescents. And so I don't know if you want me to continue. In terms of time, do you want me to continue, or are we going to the next question?
No, please, go ahead.
Okay. Do you want me to answer and go through all the questions there?
Yeah, no,
okay.
I think it makes sense, and then we can do some questions, go to the next.
Okay, perfect. And then do briefly, that is some of the work that we are doing now, and we're thankful for another 2-year grant from NIH to be able to really understand and measure social media. And so in that project, we're actually showing social media posts to Asian American teens and really getting their interpretation, that immediate interpretation, and to understand to what extent do they, is their self-concept or self-esteem experienced in those moments when they're scrolling and looking through posts, and moment to moment, is there somewhat of a update in terms of their self-esteem? That is something that I have not yet seen in the literature in terms of being able to assess sort of that direct effects, that interpretation of what you see online, and how that informs one's self-esteem and ultimately development. So one of the unanswered questions on this topic for me is really considering the fact that when you think about stress, from that framework, there's all these psychological and physiological effects. So again, if you think about being on your phone and scrolling, second to second, what is it that you're feeling? What is it that you're thinking? How are you interpreting these things? And do you absorb it? Is there some way in which you're thinking about your identity? How is it unfolding? That's something that I feel like we haven't really quite grasped, and are these repeated exposures. The way that we think about stress exposure, neighborhood violence, gun violence, school safety, how is that embedded in social media? So that's a question that I've really been interested in. But on the other hand, from the social support standpoint, I've mentioned too that there is so much sense of belonging derived from seeing others that are similar to you. And there's something so important about being able to see that, especially if you're not in a neighborhood where there are people who are like you. And so that's a pressing question that I do have as well, and that sense of safety. That was mentioned in the keynote as well, but not just physical safety, but psychological safety and the use of technology in these online spaces. When do people feel safe? When do they not feel safe? When they experience sense of belonging, is that safety? But in the next second, do you feel unsafe? I mean, that's dynamic, and we simply don't know what that does to an adolescent. In terms of what keeps me up at night, my own social media use. I'm not gonna lie. I think that as I think about my own experience there, but also figuring out, as a researcher, one of the things that I think we're really lacking is understanding what is the outcome of interest, or what is the priority outcome. So as a clinician, we often use symptom-based measures to assess how things are going. Depression, anxiety measures. We might also do something like understand functional impairment. To what extent is it affecting your social life, your academics? But what if we were to ask adolescents what is the outcome that we should measure? What is the outcome that they really care about? Maybe it's sense of belonging or feeling that they're validated. And if so, we need to really consider the trade-offs. Are we using the right outcome? Or let's measure these outcomes and really determine, can we determine what is sort of the optimal way of engaging in social media use, so that there is that derived sense of validation, but also we need to be able to understand how to regulate oneself. And that regulation is so key for anyone. I mean, I will say that after my kids go to bed, I know I should probably get ready for bed, but quite honestly, those 2 or 3 hours after they go to bed is the most unproductive time in my life. I think many parents agree, and you just stay up longer and longer, even though, your doctor said you should get a good night's sleep. And so we don't really know what's necessarily good for us, or we do know, but we choose not to. And so I think that we also, as professionals here, need to sort of think about those trade-offs for any given individual. What gives me hope is that I learned so much from our youth advisory board and from the teens, and I really do consider them as consultants. They help me from all various facets of our research, whether it's design, but also some interpretation. They're really reflective thinkers, and I think that they're the best source to go to when it comes to really understanding these processes. So for me, I'm quite hopeful that we can partner with them in doing this work.
Thank you, and thank you. That was wonderful. And what I want to do is actually have all three presenters, and then we'll do questions, because there may be some common themes that multiple panelists want to answer. So, okay. Lucia, please.
Thank you so much for the invitation to be in this panel. My name is Lucia Magis-Weinberg. I'm an assistant professor in psychology at the University of Washington, where I lead the Interact Lab, which stands for Understanding International Adolescents' Connection Through Technology. In terms of research, my group and we really want to understand the bidirectional and longitudinal associations of social media use and adolescent mental health. I was very encouraged to start hearing yesterday in the flash talks more and more the use of this very complex understanding of social media. I think we've come a long way in that. And I'm originally from Mexico, so really studying Latin America was very close to my interest and my heart. I was very encouraged from hearing the Baroness yesterday talking about the importance of the Global South. 95% of youth are growing up in countries that are not the United States, that are not Europe, that are not Australia. But we just simply, for many of these questions, we just don't know even the basics. When I started my own research in 2018 in Peru and Mexico, we just simply didn't know what platforms kids were using, what programs they were consuming, which YouTube stars they were following. So there's just a lot of descriptive exploratory work to simply understand what youth are doing. So that's very important to the work that we do in my lab. I'm now extending also to working in the United States, hopefully to work with Latino populations in the United States and find the similarities and the differences between Latino populations in the United States and Latin American populations outside. In my work, we collaborate with schools a lot. As you can understand, reaching these populations can sometimes be hard, so we have found a lot of support in working with schools. So we collaborate with schools in Latin America to, on the one hand, administer all these surveys and questionnaires to just simply understand what kids are using and doing, but also to hopefully give something back to the schools and the kids and their parents. So we train teachers on these digital citizenship programs that were developed here in the United States by Common Sense Education. I see some of my colleagues here in the audience. So there's wonderful resources here in the Global North that, through adaptation, translation, can be of great use for populations outside. So a lot of my work has been creating these tools and evaluating them, which is a very hard task, as many of my colleagues will know. And more recently, I've been more involved in policy, and I've been very grateful to be invited to be a member of the APA Health Advisory on social media and mental health for teens. I see a lot of my colleagues who are also authors on that report, to really try to communicate this message more broadly to parents, to families, to policymakers, to teachers. We came up with, the APA came up with these 10 recommendations that I'm sure some of you have read, and I'm happy to talk more about them. Recently, I've been also talking to other members of the government. I'm very happy to see that there's interest in having these conversations with multiple stakeholders. Yes, those of you who know me, I will always go on about the lack of sample diversity as the biggest problem, well, one of the biggest challenges I see on this field. As I said, we're not serving youth because we simply don't understand what most of them are doing. We talk so much about parental monitoring and parental support for youth as a very important mechanism of protection. Or the samples I work with, that is simply not a reality. Many of the youth I work with, they're the first in their families to be using their devices. They're the first in their families they're the ones, they call themselves IT support, right? We have 11-year-olds who are setting up the Wi-Fi, setting up the password, helping their parents. So it's simply not a reality where we can ask parents to be monitoring what their youth are using, and we just simply don't understand many of these realities. I work with youth who mostly speak Spanish, but other indigenous languages. Many of the resources we have are in English for a very global North reality. They just simply don't have enough resources. But that's, again, one place where social media is very exciting, because when youth are creating their own content, we are diversifying the type of contents they're producing and consuming in other languages as well. What keeps me up at night is that I'm a big believer in the many benefits of social media. I studied a lot of these questions during the pandemic, and there was never going to be a good time for the pandemic, but just imagine if the pandemic had happened even 10 years ago, right? Without Zoom, without WhatsApp, without social media. I think the pandemic was really a window that helped us see the value of connection, of positive, healthy connection through social media. But of course, that won't happen just by nature. As Baroness Kidron was saying, this digital native myth can be very, very toxic, because we're simply not preparing youth to go online. So a lot of the work that we do in the lab is through schools, which is one of the many avenues to prepare youth. And what gives me hope? Well, I agree with the power, as Cindy was mentioning, the power of youth and talking to youth. It gives me hope to hear so many of the many methodological improvements that we have been calling for a long time in the field. We saw that yesterday in the flash talks. I'm sure we'll continue to see that in the posters and other presentations. Yes, social media is just one of the many players in the lives of youth. It needs to have its rightful place. It's not the whole answer to everything. And even then, the relationship with mental health is going to be very complex. It's going to be bidirectional. It's going to be, we need to understand it through a longitudinal developmental lens. And it's going to vary very much by individual. So I'm very encouraged by these new methods, really trying to unpack heterogeneity of these effects. We were currently awarded a 5-year project with my colleague Kate Foster to start to really look at these effects with much more care. Heterogeneity, I think, is going to be a big word in the next 5 years. And yes, a push to study these questions in these very nuanced ways, both here and globally as well.
Great. Thank you very much. Cesar?
Good morning. Is this on? Yes. Good morning, everyone. My name is Cesar Escobar-Viera. I'm a trained psychiatrist and health services researcher, a public health researcher at heart, and I will allow myself to congratulate Lucia on her recently super important R01 that got funded, looking at bidirectional associations between social media and health among youth. Very proud that a Latina also is doing that work. My research is fundamentally focused on thinking about ways in which social media experiences influence mental health among marginalized youth and emerging adults. I have a strong focus on queer youth and emerging adults at that goal, and also use what we are learning about these experiences in order to develop interventions, which are digital interventions, most of the times delivered through social media, to leverage these experiences that we find to be positive, and in order to enhance mental health outcomes among these youth. To do that, we rely a lot on, we've been working a lot with self-report studies. I conduct a lot of qualitative studies as well, and we are starting to get our feet wet with actual social media data that we are starting to collect from our participants, and we hope to be able to leverage this data to use machine learning approaches to identify positive experiences and see whether these match with what our findings are in terms of the self-report studies. Related to interventions, these interventions that I work on are usually conversational agents, chatbots. We developed one that we are thinking about how to move forward in terms of further testing the feasibility of that chatbot, with a focus on reducing sense of isolation and loneliness among rural living queer youth, and also working on ways in which we can make these chatbots feel more less mechanic, less robotic, and give a lot of more useful feedback. While I devote almost 100% of my time to research, I don't currently practice as a psychiatrist. My adventures regarding the policy are related to being members of a couple of organizations and groups that are related to thinking about ways in which LGBTQ research can move forward and how to better foster and enhance and disseminate digital interventions. To me, at least, there are many important unanswered questions in the topic of social media, but to me at least, one that is essential is what are these protective factors that we can extract from social media? And are they similar or different to protective factors that we can extract from real life? Well, I would say real life in quotes because social media experiences are also real. They happen in our real life. If they are somewhat or similarly, or to some extent more strongly protective for marginalized youth, try to think for whom and under what circumstances they are protective, because that is what I think we need to know in order to then decide to leverage these experiences for potential interventions. What keeps me up at night? Asking myself how to intervene in order to create safer experiences for marginalized youth on social media, because from what we've learned in the past few years, both through qualitative and quantitative studies, is that for queer adolescents, social media is a key source of information, emotional support, building community that a lot of times they're not able. Think about this as a developmental goal of adolescence as well. And when they're not able to build and feel part of a community in their physical community, which happens a lot with queer youth, and even more so if they live in rural areas, they need to find another outlet where they can attain that developmental milestone, and that's what's happening. I mean, I'm completely unable to match Ari's presentation earlier, but that's what's happening with a lot of our teens who identify as queer and live in environments that are not supportive. Resourcing to social media is a tool they have, and well, how can we intervene to make this a safer experience? What gives me hope, what Jim was talking about, the continuous prioritization and interest from NIH and other funders in funding research in this area. I'm very grateful with the change, with the ongoing change in focus because of the numerous mixed findings between studies that found association between social media use as in volume or quantity and mental health, and a lot of other studies who found absolutely no association. So given these mixed findings, I'm very grateful to see that a lot of people doing this research are starting to focus a lot more, and rightfully so, in my opinion, on the type of interactions and behaviors that we engage in on social media, and look at those in terms of the impact in mental health. And three, the resilience and persistence that we found in marginalized youth who seek the supports on social media that they need and they can't find in their communities. Thank you.
Okay, I know this is a little sometimes hard for people seated in the middle, but let's do these as, I think, if people could queue up behind the microphones, and then we'll just trade off between one and the other if people are on both sides. It's just more efficient than trying to do the Oprah and run a microphone around. So if you're ready, well, please, go ahead.
Hi, thank you so much for sharing your research, your passions, and helping catalyze this critical conversation. So Sydney, I saw inside your presentation that you had mentioned gaming as well. And I would be interested from all the speakers, or specifically Cindy, if you could expand a little bit more on how gaming may be a little bit different than the research that you've seen with social media.
Absolutely. Okay, can you hear me? It is different, yeah. I mean, I think there are gender differences when it comes to particular social media use and the particular platform, but certainly there is a gender difference in terms of gaming. My postdoc actually just submitted a paper yesterday on looking at social media and gaming and looking at sort of the sort of differential effects in terms of those two. And you know, with gaming, her framework there was that both may be a means for coping. And so if you weren't engaged in social media use or gaming, what would you be doing? And so we actually found some really interesting racial differences in terms of the usage. And so, you know, with my particular interest in Asians, we did find that Asians were more likely to engage in gaming and that it was actually more problematic for their academic performance. Now, you could sort of think about all the different ways in terms of how people interpret what is affecting your academic performance negatively, but nonetheless, we did see higher prevalence in gaming. And that really mirrors sort of worldwide prevalence, or like when you look at the prevalence among Asian countries in terms of gaming. But what is so compelling? Well, there's many compelling things about gaming, but you know, we were looking at this in terms of college students. And gaming, you know, among college students, you envision being in your dorm room, and maybe it's just you, or maybe it's just you and another person involved with gaming, versus like at a university setting, there's so many different ways, if you're on campus, to engage with other people and in other activities. And so we did surmise that for maybe other groups, that there are these other opportunities. So there's so much more to be learned about gaming in particular, but also, I think for me, I'm really practical, so I think about where do you physically do these things, you know? And where is it taking you away from? And for social media, where are you doing these things? And what is it that's taking you, you know, what is it that you're not doing because you're engaged in that? And so I think the framework is really interesting. I do think we have to like really pick apart the nuances. And when we talk about technology or social media, to be able to go, how are you measuring that? So yeah, thank you.
Thank you so much.
You know, could you identify yourself?
Oh, yes. My name is Kylie Woodman. I'm a PhD student at UCSB. Thank you.
And did the other panelists want to answer? Yeah, please.
If I could just briefly add, I mostly focus on social media, and I think many of us have, and I think that has led us to incorrectly, I think we make a lot of assumptions about girls, and we're not really capturing the social interactions of early adolescent boys in particular. We heard a lot from boys that during the pandemic, early on, they're connecting, they're gaming, but they're also chatting, right? And capturing that social aspect of gaming, I don't know how to do it well. I think it's so important. I see it as a technological analogy of boys playing basketball, but also chatting while they're playing basketball, and how we capture that social aspect, which was so important, we heard from early adolescent boys, to communicate during the pandemic. I don't know how to do it well, so very keen to hear from you.
I have a household of boys, and they do this, and I'm marveled by the social aspect of it, and I'm totally supportive of it within bounds.
The one thing I will say about that is I'm co-investigator in one of my colleagues' study testing the effectiveness of a gaming intervention for queer youth to develop self-efficacy and other outcomes. And the reason why I'm there, I'm part of that project, is because during the early feasibility studies they conducted, participants asked a lot about developing, using gaming as, or developing a sense of self-efficacy in managing the interactions they have during the gaming experience, the chatting, or the other social interactions that happen during that. And I think I'm not, it's not my field, but I think what youth are asking is to learn to develop more literacy in that sense as well, and maybe that's a field that needs to be explored a lot more with our research.
Thank you so much.
Thank you. And I know people who make the distinction between gaming and social media. I helped to remind people earlier this year, all those Pentagon highly classified documents were leaked on a World of Warcraft chat board. So, not so much. Please.
Hi, thank you all for sharing your thoughts and experiences.
Can you say who you are?
I'm Patricia Conrad, and I am a professor of psychiatry and addiction at the University of Montreal. And so my questions and comments for you come from the addiction field, where we are decades ahead of this field in terms of experimenting with evidence-based interventions to prevent harms from adolescent substance use. And I want to encourage the panel, the chair of the panel, the audience, to reflect on that literature for many reasons. First of all, it's there. It is very helpful. Second of all, I think the product that we're talking about now is very similar to substances like alcohol, cannabis, tobacco. It's clear that it alters decision-making while you're engaging with it, okay? It is clear that it impacts on reinforcement systems of the brain. Some products actually do that at supraphysiologic levels. It's not clear, but supernatural, most definitely, not naturally. The third thing is that this technology and the way it's designed today is also designed to essentially reinforce behavior to come back to it. That is the nature of an addictive behavior. So we're talking about an addictive product. Now, what I'd like to just remind everyone is that common sense education programs do not work to help young people manage their behavior around addictive substances. And we've known that for 30 years. It's really important that if we are to design interventions now that are going to help young people manage their behavior around this addictive product, that we start to think about it as an addictive product, and we design programs that will help young people manage the habit formation form of it, but also this dilemma that they have, which is there are good parts about it. Mm-hmm. There are parts about it that really do make them feel good in the moment, like tobacco or alcohol, usually about 30 minutes, and it feels really good. And it's designed, and it is addressing some very core dissatisfaction, distress, or really unbearable emotions for young people. Like alcohol, like cannabis, like tobacco, it's a quick fix, but it has these long-term consequences, and those are very well described for digital media now too, especially social media. So the interventions that help young people prevent substance use and misuse and harm are ones that equip them with skills to manage the reasons why they're using and misusing. It's not surprising that the digital citizenship in RCTs are not protecting young people from the harms and not producing good mental health effects. It's because we need to go further. We need to help young people learn to manage the stuff that's making them want to do this. So, for example, just one question.
I do want to have the panel have time to respond.
Last question for the panel, I'm sorry, is, so are interventions now being developed that will provide alternatives? For example, a lonely young person. Let's test interventions that are addressing the underlying motivation and not simply trying to protect their right to use digital media as a way to protect it. Tell us about those interventions.
Thank you. Thank you.
I can speak to just sort of reinforcing what you're referring to. So in our latest data on gaming and social media use, what we saw was one of the biggest predictors was low distress tolerance. And so, in our sort of attempt to try to translate is to be able to come back to some of those basic principles that we, as clinicians, we work with, people of all ages to be able to cope in the moment. But in terms of the interventions, that's sort of outside of the scope in terms of what is being done so far. So I'd love to just hear from others.
Thank you. Wow, this microphone is not. Thank you for that question. And yes, talking about distress tolerance, we do have an ongoing study that is focused on suicide prevention, in which we are using a chatbot to deliver a number of basically 2 and possibly a third intervention ingredient that we're thinking on. One is social media literacy, because this is among youth who are at risk for suicide and have experienced cyberbullying on social media. So there's a social media literacy component, and there's also the stress tolerance component that we are using. But we also come to our intervention development process with a lot of humility in terms of learning a lot from our participant experiences. And the third possible component that we are thinking is social connectedness, how to increase both quantity and quality of social connections, because we are repeatedly getting that feedback from our participants. And I appreciate that you're coming from the substance use field. We also know that there is for some of those behaviors, there's also predisposition that we also need to address and consider that while it might be a risk factor for some, it might not be a risk factor for everyone. So we are addressing to the extent that the outcomes that we are looking at require looking at things like the stress tolerance and social connectedness as well.
Thank you. And again, it's a great question. Of course, it's not that these are orthogonal. You have adolescents who are abusing licit and illicit drugs and engaging in these things. Thank you. Please.
Hi, my name is Beth Daniels, and I'm a professor and director of the Center for Appearance Research at the University of the West of England. So that introduction kind of leads into a self-serving question, but and ties into the last question a little bit. And the symposium started by talking about siloing, and that's fundamentally my question, and I'd love to hear your thoughts about how we bring some of this, for instance, what we know from addiction research. As a body image researcher, there aren't a lot of people in the research community that I'm part of who are here today. We've had so much great attention about social media and mental health issues, but body image has kind of been not part of that conversation. So again, kind of bringing it back to siloing, and I'd love to hear what your thoughts are about how do we bring these very related and important issues together instead of being in our own little corner and sort of not connecting. So thanks again for your talk. That was very interesting.
Responses? Yes? Okay.
Well, I'd say I completely agree. When we say mental health, it's just such a broad umbrella of terms. Even digital citizenship is even tackling even more than just mental health. So I do find it very challenging. Definitely body image, I think, is where we're having the strongest evidence for potential social media harms. So yeah, super, super important topic. These issues of social comparisons, where these platforms have these features like the likes and the quantifiability and the transformation network that Jackie Nessie and Sophia Chukas-Bradley and Mitch Prinstein talk about so much, that has been so impactful in my own thinking. And it's a challenge that many youth are facing, girls, boys, and other minorities. Yeah, how to bring them together is hard. I work a lot with teachers. Teachers sometimes feel uncomfortable in these positions. They're not trained as psychologists, right? And they're uncomfortable in many of these spaces. So that for me has been a challenge. It's easy for them to talk about, okay, how do you regulate your screen time? How many hours are you spending online? But when it comes to these much more complicated topics, they shy away from them. So a lot of the work we do is trying to understand how to best support them. Teachers who are already so burdened, right, with so many things and so many things to tackle.
I would say that this conference is the start, especially for me in particular, because I didn't study this in graduate school. And many researchers who are senior wouldn't have done that either, and actually many people don't have the experience themselves in understanding how it feels to engage in social media. And so I think that there's just a real lack of experience, but also training. And so I would be curious to know if current training programs embed some sort of module or some sort of course to help understand social media and technology within studying mental health, right? I'm a clinical psychologist, so our PhD programs, when we think about mental health, does adolescent development, the course on that, and mental health incorporate this? I'm not sure. I'd love if people are here know, I would love to know, because quite honestly, there is, yes. But for me, there wasn't, right? And so that's where there's just such a huge learning curve for somebody like myself who has studied socialization and is really trying now to appreciate and be able to measure this. So I think that there's just a big gap and a lot of catch-up that is needed to be done.
And I would add that we need a CAMRA ACT take two and start funding things like centers, for example. We need a P50 that might help bring together researchers who are looking at laws, privacy laws, ethics of data collection, body image, mental health, physical health, and that can only be achieved, in my opinion, with the right kind of funding that allows those studies. Now we have, by my count, the first 8 R01s that are looking specifically at bidirectional associations of social media and health, and we need to move that further because these studies are only getting more expensive with what we know needs to be done, like collection of objective data, for example. So I think that will also help break the silos and bring people together and look at those things.
Thank you so much. And I'll note that I'm actually in England now as an American, going to England because there's a center there. So I think your last point is really on target. So
and I would just say from a funder's perspective, 2 years ago, we had a request for application. We actually funded 3 project grants, which tend to be, they're multi-project grants. They are larger. NIMH, National Institute of Mental Health, did an RFA. They just released their awards. And we funded 2 R21s from that, but there were also several R01s. So, there is an uptick in funding opportunities, but you can always do, not for centers, but for R01s and every other mechanism, unsolicited. There's always the parent that you can put things in. Okay.
And just very briefly, we talk so much about funding, and we're doing all these hoops as researchers to get this data when it's being already collected by social media companies every day at every second. And we're trying to come up with passive sensing with other tools and programs. And if we could work with companies to use this data responsibly, I think that would save a lot of money.
That is true. Please.
Hi, my name is Lauren, and I guess I'm in my clinical internship year, so I'm from the University of Minnesota, and getting my degree in clinical and developmental psych. And just to answer your question, my program did not have anything on media, and our media week was about television from the 90s, so hopefully that's changed maybe. But I work with a lot with older children and teens, and also my research is on problematic media use in more children areas. And I think there's this kind of balance between externalizing and internalizing that happens. We have all these great resilience factors for internalizing and risk factors. And for externalizing, there's not a lot of great resilience factors that come to externalizing from media. And when I think about older children, 10, 11, 9, I'm seeing a lot of comorbidity with ADHD and other externalizing symptoms. So I'm curious, I know you all are more adolescent researchers, but can you think of ways that researchers or even adolescent researchers can start to think a little bit earlier about how the externalizing and internalizing maybe work together in individual children and teens, if that makes sense?
I think we heard a bit in the flash talks yesterday, and I'm very curious to look at the posters. We heard a lot from researchers focusing on early childhood. We heard a lot of parents using devices to manage more of these externalizing type behaviors, and how that in turn is not letting kids develop the skills to then self-regulate. We're hearing a lot about that. I think that's an exciting emerging area of research, and completely agree that we need to start much earlier from a developmental lens, right? These things have a much earlier origin.
No? Pass? Okay. Please, next question.
Hi. Yesterday I asked a question about, to the editors, about data collection, as Cesar mentioned, that's objective, right? Not just self-reports, because they're pretty unreliable. I was wondering, from your perspective as a funder, they all agreed that that's important. Is that something you think about in the world of funding, if, say, 50% or 70% of the grants were for projects using either passive collection or even screenshots of the data? And I just ask this because we're all here because this issue is so important, it's affecting children so much, and we all know if you use unreliable data, then the research is really not meaningful. So I'm wondering how you think about that, and the unique role a large funder with $15 million might be able to play in making that a norm among research in this area.
Do you want to answer any of this? And then I can comment, but no. I mean, but it was touched upon. I mean, one of the reasons, the great strengths that we have is peer review. And one of the great weaknesses we have is peer review. And what we have are sometimes peer reviewers who are maybe not as knowledgeable about the latest methods, and they will see a weakness when it's really a strength, or someone who doesn't have as much background in an area is treated equally as somebody who has years of experience. I mean, it happens. It's a human enterprise. That's part of what our job is in terms of the convening function and also scientific stewardship. And so really encouraging and trying to bring to light, when there are new methodologies, because right now, a lot of what's out there is correlational or associational. It's not the best methods. There's still a lot of self-report or other things, and the more objective measures get equal weight, or they get a lot less press play, because, hey, it's just human nature. Those are the studies that get the most attention. Sometimes the weakest, and the authors even admit, this is correlational, but they still make causal statements, and the media makes causal statements. So I think there is a role for everyone to play, peer review, but also, from our perspective, we really do look at those things and encourage and try to network. This is breaking down the silos, people understanding methodologies, maybe even from a different area, that they can apply to theirs, and vice versa.
And do you consider ever putting like a 50% of the funds? I studied economics, actually. I'm a big believer in incentives, right? And it does seem like behavior follows incentives. So is that something that you would consider by having some sort of explicit incentive? It just strikes me that you would be in a position to move the field to more reliable data so that we'd have more confidence in talking about the data that shows how it's affecting children so profoundly.
Honestly, I think one of the problems we have in the field, and I don't want to take too much time on this, we can have just an individual conversation, but is that a lot of what's done and even what comes in is not very strong, and it doesn't necessarily use the best methodologies. We can do grants that help people develop methods and measurement techniques, and I mean, we do that, and sometimes that moves fields forward exponentially. So you are right, but it's like one of those things, sometimes we take from the field and really try to digest where things are at, and sometimes where things aren't moving. And honestly, measurement and design issues are the things the field least likes to engage in. They're hard, they take a lot of time, they're thankless. So people don't do them, and we often have to put money in to specifically encourage those. So, I mean, you're right in that sense. And I do think we do that, and we've certainly, NIH, and certainly in my area of research, we've done that and done that successfully. So you're right, this may be something really we want to look at.
Thank you.
Thank you.
Hi, hello, my name is Fran Fleming. I'm from the Rudd Center for Food Policy and Health at the University of Connecticut. One of the things that I haven't heard mentioned is marketing. So all of the research that's being done on these social media platforms, gaming, other spaces, is just ripe for marketers to really reach young people. So when we think about the negative outcomes in terms of addiction or use, there is a role here of what products are being promoted while people are on these different sites. And, you know, one example would be gaming, right, which is filled with energy drink promotion. And in really weird ways that other researchers have focused on more directly than I have recently. So the negative outcomes that you might see from use might have something to do with consumption of energy drinks or the other, just really unhealthy foods that are marketed just more generally in all these spaces. So I was just wondering if some of you could respond to those types of considerations that maybe you have in your research or don't, and just share that a little bit.
I'm very mindful of time. That's not something that I focus personally on my research, but it's such a powerful space for peer norms, and marketing, I think, is a predator of that space. A big space for regulation, where I think it's very clear that youth are seeing things that they shouldn't be seeing, and they have a very powerful effect on them. So I don't do the research, but I agree that it should be regulated heavily.
Same here as well.
And I will say, we are at time, but we started a little bit late, and you all deserve your coffee break. But if we can finish up the last two questions, if you want to go get coffee, no one is going to judge you for that. But if we can finish the last two questions, and then we'll end the session. Please.
Great. Thank you. My name is Javier. I'm a co-founder at Pandora's Way and also with the Berkman Klein Center in Harvard. And I'm very grateful for your work and your time, so I'll be very quick. My question for you is, what are the best practices for social entrepreneurs like ourselves to work with academia and the research community so that we can both multiply our possibilities of having positive impact in this problem, and in particular, ways of working together that are effective, that are ethical, and we can advance together when it comes to interventions?
Would you mind just saying a little bit more about what you do?
Sure. We have a hypothesis that coming-of-age rituals can be a very effective way to introduce the smartphone or digital devices into kids' lives when they're becoming adolescents. And we're creating a method, a toolkit for families to do that and communities to implement that at scale. But we want to work with scientists across fields so that we can represent, Asian families, we can represent LGBTQ kids, and make sure we're effective.
That's great. I would just say that that's wonderful. And I would love to talk with you further about that. I think for me, it's a matter of figuring out the evidence and whether the evidence is sufficient for us to be able to put that into practice, and just being very cautious of not giving guidance without that evidence for parents. And so for me, I would say that's my evaluation, that I have to evaluate that for myself, but would love to just talk with you more about that opportunity.
There are, I'm not sure if this is what you're asking, but there are a number of also funding opportunities that incentivize collaboration between small enterprise and research to test interventions of different kinds. Potentially, that would be a way of start thinking on developing a collaboration of that nature.
Great. Thank you.
Thank you. Last question?
That's okay.
No.
Okay. Emily Weinstein, Harvard Graduate School of Education. Thank you so much for your work and presentations. I'm struck in listening to your presentations and some of the questions that the metaphors we use to talk about technology and digital media really matter. And I'm just wondering, rather than us taking for granted that, for example, tobacco is the right metaphor, which has really profound implications for the way we think about intervention, the way we think about education for kids and teens, I'm just wondering if you could talk about your views on perhaps the tobacco metaphor, but maybe on other metaphors that you're finding really resonate with you as you think about this work and as you think about what interventions are needed and helpful.
Well, I guess the seatbelt metaphor for me, I think, resonates a lot. That this is a seatbelt moment for the tech industry. And I think cars, for example, can open up a lot of avenues for exploration, and they can get to places, right? Cars in itself can be very positive, but they need regulatory standards, and there's things that can make them safe. So I like that metaphor a lot.
I would say, did y'all know that LGBTQ populations are the #1 target of tobacco companies on social media? That is widely, there's wide evidence of that right now. And it's like a situation in which potentially addictive vehicle is promoting another potentially addictive vehicle. I think, and there's a lot of work I think going on in that area, including the affected communities, whether it's LGBTQ or other communities, just doing this very purposive sampling in order to learn from their experience and then think about whatever type of intervention we are delivering is one way of think about it. Sorry for this very simple answer, Emily.
I would say for me, I actually don't know. I have a particular framework as a parent. So for me, as a parent and in the moment, I have a particular framework. But I think as a researcher, I don't know yet. So I really appreciate your question.
Yeah, and the only clarification I would give is there's really kind of three things. There's research, including public health research, there's policy practice, and then there's regulation. We do the research, we have nothing to do. I mean, we try to do things that inform those other two, but we have no ability. I mean, I can't go to Google and say, you must give us your, I mean, it doesn't work that way. And likewise, we really try to keep a firewall so that the others aren't telling us what research we can and can't do. And I think that's always problematic when that happens. And we know kind of what happens when science becomes politicized, especially public health issues. So, that's kind of I don't want to end on that note. I'd rather end on a hopeful one, which is I hope this gives you hope. I mean, because I put that question in there. All three of you give me hope. Everyone and all the great questions give me hope. I hope you agree this was a really productive session. It raises more questions than it answers, and as I said, we're nonprofits. So go forth, answer them. Thank you.